My name's Paul Moore. I'm Regional CEO for the West Region for Humana, operating in 19 different states, although I only have health plans in a few of them. But Humana is very strategically aligned around consumerism, which a major component of consumerism is wellness, and improving health of our members in the commercial arena, and that's how we refer to the under age 65 population. And as you all know, Humana is a very strong focal player in the retiree Medicare space. We have millions of post-65 retiree Medicare clients as well, where wellness is also a strong component of what we do for seniors. Corporate health and wellness is extremely important because corporate health costs are so high, and it's such a significant expense for corporate America to be able to, which is really the main arena where our population gets their health care coverage, and the expense of it associated with it on corporations, but also on individuals who are sharing significantly in those premiums, is just climbing at such a dramatic rate that there are just all kinds of things that need to be done to help with that cost. And you have a healthcare reform initiative going on in Congress right now to try to address many of them, although not all. We feel that the primary driver of healthcare cost is the wellness of our society, or the lack of it, and helping our clients to come up with strategies to incorporate wellness and accelerate the component that wellness plays in their overall benefit programs is not only important for our clients in terms of their costs, but more importantly, it's important for their members to become healthy, well people, which is important for our society to address our real healthcare problem from a cost perspective, is primarily driven on the lack of wellness that we have as a society. If we can improve that, we can certainly manage the cost of our healthcare much, much better. Wellness is a win-win for corporations who are trying to economically provide benefits to their employees and those actual employees themselves for a number of reasons. From a corporate perspective, the long-term cost controls that wellness programs can deliver in the short, medium, and long term are significant, and corporations will have a better handle on their rising costs the more well their employee population becomes, without question. The other issue, which is different than just healthcare claim costs that corporations are responsible for, is they're responsible for delivering a product, a service, whatever business that corporation happens to be in the most economical fashion possible. And employee productivity and the productivity of their overall human capital is a significant component of that, of their ability to do that. And well employees are much more productive. Well employees have much less absenteeism, and for that reason alone, corporations can perform better because their people are there at the workplace doing their job and helping deliver on their value proposition to their markets better, because their employees are better capable to do so because they're more fit, they're healthier, they have less need to go to doctors, chiropractors, physical therapists, mental health professionals, all the services that people need, but the less they need them, the lower the cost, the more productive they are.
Regarding that?
From a corporate perspective, some of the additional benefits of wellness programs are when obviously you're more competitive, you have a healthier population, your employees are more productive. If that's culturally a trademark or a brand as an employer that a corporation can have, it's certainly a more attractive place to work. They can be more competitive in terms of not only acquiring talent, but also retaining the talent they have. Employees are much more likely to stay employed at an employer that they feel cares about them, that gives them the tools to be well, that gives them the opportunity to improve their lives, and ultimately makes them a healthier, better person being affiliated with that company than if they were to work somewhere else where those types of programs weren't in place. From an employee perspective, I think that people generally want to know, what can I do to improve my health, improve my lifestyle, improve my productivity, improve how I feel. And when we give them tools as employers and as health plan providers, giving them tools to do so. They appreciate that, and we find statistically that they are very engaged in pursuing those types of tools when they're made available. The wellness programs that we find that have the most impact, there's not one magic program that changes the dynamic. It comes down to incorporating multiple programs, because there's so many different touch points within an overall benefit program and a wellness program that need to be coordinated and understood. But certainly you want to, whatever you can do as an employer to increase activity levels for employees, very key. As Americans, our inactivity level is extremely high. We have to get at that. Simple things. We have a miles program at Humana where people get out and have pedometers and are measured on how much they walk, their rewards associated with the amount they walk. Just a really simple thing that increases activity. You can have a gym. They're available to people at the work site, and some people will use it. If there are ways you could figure out to bring activity levels to employees where they're actually working, as opposed to asking them to come to your gym facility, that's even better. So that increases activity, increases wellness. At Humana, we changed our entire cafeteria in our corporate headquarters to include mostly all healthy food choices. And it required a re-engineering of that entire operation, but ultimately if we want our employees to be healthy, we have to provide them the means to do so, and employers can do that. The corporate wellness industry, or the health benefits industry that incorporates wellness themes, is evolving very quickly. There's been a lot of work done already, a lot of good ground taken at trying to identify risks, help employees assess their risk by going through health risk assessments, for example, by having outreach programs where you have nursing staff that can reach out and actually call employees, talk about their health risk assessment, talk about their medications, make sure they're taking their medications, make sure they understand what the impact of not taking their medications can have on a diabetic, for example, where serious health complications can result by not being attentive to those things. I think a lot of that is happening now. It's not happening across the board. All employers aren't doing the same things, but that's the path that most are headed down. Eventually, there'll be more rewards or even punishments associated with employees not engaging in the health and wellness tools that are provided to them. I think employers are evolving to the point where they feel, I can only afford to provide X amount of benefit to my employees in the current state of wellness that we're in. I am working hard to improve their state of wellness from its current level, and those employees that are engaged in that, I'm going to reward them for it in terms of cost sharing, whatever it is. And those that aren't, frankly, it's going to be detrimental to them. And more employers are willing to accept that as a way to change behavior. I think this conference has been great because it highlights the importance of wellness and it brings people together who are committed to that and like-minded about that. And that's wonderful. The exchange of ideas that happens here in the sessions, I think, is outstanding. Everybody has a knowledgeable perspective, but we can always learn from one another, and frankly, that's where we learn most. And a conference like this allows us to do that, and it's not only in the formal sessions, but also some of the networking opportunities that are provided, and just the social settings that are provided allow people to have dialogue in an informal setting. It's a relaxed environment, and the exchange of ideas really flourishes. Having an organization like the Health and Wellness Association is extremely important for no other reason than it just provides a forum like we have here this week for executives and contributors to the health and wellness arena to get together and share ideas and also establish the relationships and the network of professionals that are similarly engaged, so we can build on our social contacts and our professional contacts. So we have the other 364 days of the year, we can network over the phone, get together, share ideas, and this formal conference and forum allows us to establish that, so we can do that on an ongoing basis. And you meet a lot of great people, you make new friends and new professional associations. It has all of that benefit. Humana is extremely committed to wellness. We have serious financial investment in it. We certainly think we can improve our financial performance as a corporation by being engaged in wellness programs and continue to innovate surrounding wellness themes, and we will do so because that's our responsibility to our shareholders. We also feel a community sense of urgency and commitment to help America improve its state of health, because ultimately that is the cost driver. And whatever we can do, whether it's working with our seniors or working with our corporate clients for the under age 65 population, or even working with kids to help them get on the right path, because child obesity is a major, major issue and it's going to affect wellness in our country for years to come. It's our responsibility as a company that's engaged in this business to make sure that we're doing everything we can to address those issues that are very, very important.